caregivers, and thanks for joining the Caregiver Foundation for our monthly caregiver support group. Today, we are so pleased to have Tani Salazar with the State of Hawaii Executive Office on Aging. And I met Tani maybe a year or so ago at a resource fair sponsored by Hale Holi Hawaii, one of our past presenters. And Tani's here to explain what happens at the state level and also many resources that are available to caregivers. So I'll turn it over to Tani, and she can give you more background about the Executive Office on Aging and some information about some exciting programs for caregivers. So Tani, thanks for being here today.
Well, mahalo nui loa for such a kind introduction and for allowing me to come and to share with you all and to be in this space together on Zoom. Hope you can see my screen as it comes up. Yeah. Okay. Thank you. I'm so grateful to see some familiar faces, new ones. So thanks so much for joining today. And this might be very familiar for you, so feel free to jump in and share your thoughts and experiences because there's so much, I think, wisdom and experience in the room with all of you here. And I think that's the best part of our learning together. So aloha mai kako. My name is Tani Salazar, and I'm here to share on behalf of Hawaii Dementia Initiative, our coalition of stakeholders across the state. I wanted to first kind of start off and ask around the room. I'm adjusting myself so I can see everybody. Who here is caring for somebody living with dementia or knows somebody living with dementia? I see hands there. Thank you so much for sharing. Yeah, I'm with you there. You know, three of my grandparents lived with different types of dementia. These are their photos here, and they really inspire me in this to serve older adults, to serve kupuna, to promote brain health, and to care for caregivers. They are also caregivers, and I admire their example. So I just wanted to honor them in this space. I'm here today because of them. And through that inspiration from my grandparents, it led me to pursue a career in social work and specifically in gerontology. And it's been nearly a decade now working with older adults in skilled nursing facility settings, in a retirement living setting. I just had the privilege to work with people in our community who are going through this journey at various stages. I wanted to for acknowledgement to acknowledge Hawaii as an indigenous space and the ancestral homelands of Kanaka Maoli and the importance and of that kuleana that I take seriously to care for our people here. I'm actually calling in from an International Indigenous Dementia Research Network conference, and people from the globe are coming together, sharing about the work that they're doing for people with dementia in indigenous communities around the world and how they're supporting and caring for caregivers. So I'm so humbled to learn in this space and also to learn from all of you. So I hope you'll share your experiences as well. This is a little bit about our agenda and where we're going to be going today. I'll do a brief overview about what it's to just level set for all of us here. I'll talk about what Hawaii Dementia Initiative is, our coalition, and our state strategic plan, which some of you in the room have been a big part of. We'll share a little bit about the Dementia Public Awareness Campaign that's out now, our Dementia Champion Project, some caregiver training and educational opportunities to learn more about caregiving strategies. And then if there's time, we'll talk about some services like the Aging and Disability Resource Center and our area agencies on aging across the state. But feel free to talk at any time or chat, and I'd love to continue the conversation. So to start off, what is dementia? Dementia is not a specific disease, but it's that overall term or that umbrella term that describes a wide range of symptoms that affect our ability to do our day-to-day activities. You know, and dementia is not a normal part of aging. So not everybody who grows old develops dementia. And it's caused by different diseases of the brain, and Alzheimer's disease is the most common one. But as you see on screen, many different kinds. There's, vascular dementia, which is related to strokes, Parkinson's disease dementia. My grandfather had that one. There's Lewy body dementia, frontotemporal dementia, and even mixed dementia, when someone might have multiple types of dementia occurring in their brain. So I do want to call out that know, someone can still have a good quality of life with living with dementia, and people living with dementia are still people. They're still deserving of dignity and respect and a valuable part of our community. And on screen, you can see here, there are some different risk factors of dementia. This diagram on the right is from the Land Commission, and it shows, that there are things that we have the ability to change and do that can help to reduce our risk. They're saying that nearly half of dementia cases can be related to these modifiable lifestyle risk factors. So things that are good for our heart, like exercise and eating well, nutritious diet, and getting good sleep. Those things are also very good for our brain health. In the same breath, I also want to share that a lot, we don't choose, the neighborhoods that we grew up in, the circumstances that we live under. And, there are factors even out of our control that can affect our dementia risk, and our access to be able to reduce our risk in these areas. And that's something that we're working on together. These are some statistics for Hawaii on Alzheimer's disease and dementia. So Alzheimer's disease is the fifth leading cause of death in Hawaii. And it's projected to impact about 31,000, probably closer to 35,000 people in Hawaii. But again, that's just Alzheimer's disease. We just learned that there are different types of dementia. So this is impacting many families statewide. It's estimated that nearly, 1 in 10 adults 65 years older are experiencing cognitive decline, and 1 in 3 adults age 85 years and older live with Alzheimer's. 1 in 5 adults in Hawaii are caregivers, and nearly 30%, 27% of caregivers are caring for someone living with dementia. So the big message to all of you here is that you're not alone. There's a lot of us going through this journey. It's so wonderful that we get to share in a space like this as a support group, to know that we're not alone. We're all going through this, and we can live together. So what do we do now that we know that dementia, is a growing public health concern, and what are we going to do for our people in Hawaii? So on screen is our Hawaii 2030 strategic plan on Alzheimer's disease and related dementias. And it's an accumulation of our stakeholder voices over the planning period who shared, what's most important for people living with dementia. What we need to do to better care for our caregivers. How can we improve care and reduce risk across our state? This state plan is aligned with that Healthy Brain Initiative, which national movement that seeks to increase the understanding of brain health as a central part of our overall health and should be prioritized in our public health practice. At our level, at the Executive Office on Aging, we have a federal grant, the BOLD grant, which is helping to fund the coordination of this work, to fund some education for the public, for caregivers, as well as for professionals. And at a local level, Hawaii Dementia Initiative is that coalition that's working together collaboratively to implement the state plan together. And an important part, a vital part of that state plan is this Native Hawaiian roadmap, navigating the impacts of na ma'ipoina, or the forgetting sicknesses, Alzheimer's disease and related dementias. So there's a QR code on screen. If you're interested, feel free to scan it and it'll take you to the roadmap. I can also share the link later. But this is a roadmap that was created by Native Hawaiians for Native Hawaiians. And Papaololokahi, led the effort to meet with community to develop the state plan. And they met on multiple islands. So you see those different island reports on there. And now Kula Nona Po'e Hawaii is leading the way in implementation. And they're doing talk story sessions across our state and Native Hawaiian communities to listen to community, to see what are the needs, what are the strengths of our community, and what strategies can we prioritize and work on together to address dementia in our communities and in our ohanas. The mission that's guiding this work is that we are committed to embrace and support with aloha all of Hawaii's people who are touched by Alzheimer's disease or related dementias, from prevention and early detection through end of life, keeping alive the hope of an eventual cure and aiming for the best quality of life for all. And this is a picture of our Hawaii Dementia Initiative Coalition. Shout out to Susan in there in the room. Might be able to find her in our group picture where we got to come in person to share in that aloha and that relationship, but also to build momentum for this work together. And on screen, different action teams that our community is organized into so that we can work on strategies different fronts. So there's people working on dementia caregiving, on workforce development, ensuring that our professionals are empowered to be dementia capable. There are people working on brain health, risk reduction, on community clinical linkages, early detection and diagnosis, public awareness and education, as well as data action. And we're so grateful to everybody involved for their time and their efforts and their aloha that they put into this work. So we can't do it alone. It will take all of us working together. On screen is the new website that we recently launched. It's hawaiidementia.org. Again, hawaiidementia.org. And the coalition members really poured in their mana'o and their thoughts into, what kind of information and education do we want to share with the community about brain health, about caregiving resources, and about early detection. And if there's time later, we can do a little demo to show you how to navigate the website, but it's continuing to grow as we learn more about resources out there. So we welcome your feedback. And this website is also the landing page for the public awareness campaign now. On another project, this is the Healthy Brain Tracker. So this is Hawaii's first dementia data dashboard. So if you ever wonder, what are the rates of Alzheimer's disease or dementia in the community? What are the demographics of caregivers in our community who are caring for people with dementia? And information on that. If you're interested in data or statistics, feel free to visit the data tracker and that website. But this data is to inform our policies and our programs to ensure that we're walking with intention and that our programs will really serve the needs of the community. And that's the goal. We're thankful our Hawaii State Legislature really recognizes that dementia is a growing public health concern and have put support in this effort. And they funded a public awareness campaign. This campaign's goal is to, raise awareness about dementia, to decrease stigma, and then to improve early detection. Many of us, our families, we didn't know the person had dementia until they were in the mid to late stages. And our goal is to reach families earlier on in the journey so that we can provide support and education and resources. And also there are new treatments available to people who are in the early stages of dementia and new research around lifestyle and things that we really want to wrap around that ohana or earlier on. So as this campaign is going out, it started a couple months ago and will continue through November. And I'd love to share this PSA with you all. If you can give me a thumbs up when you can hear it, that would be great. Thank
you. Do you remember your first kiss, your wedding day, your child's first steps? Memories are precious. Protect them now before they're lost. If you or someone you love is experiencing early signs of dementia, like confusion, repeating questions, struggling to find words, talk to your doctor. Learn the signs at hawaiidementia.org.
So we're thankful for Anthology Marketing Group who, really listened to caregivers, to community, to understand Hawaii's people's perspectives, about dementia, to inform that campaign, to ensure that it speaks to our local people here. And our goal is our workforce here would be dementia capable and that our communities would be dementia friendly. And our public awareness team and the workforce team, as well as our caregiving team, has come together to put together to create this dementia champion campaign. And the goal is to recognize people who have received, dementia training and education as allies and supporters. So they'll receive these dementia champion pins. And the caregivers also wanted a way to self-identify. It's totally optional, but they wanted a way for when we're going into community and bringing a loved one who is living with dementia, a way to let the staff know, or to let other people know, to be more patient, to be more understanding, to share aloha with our person who may be living with dementia. So they created this I am here sticker to represent that even if someone is living with dementia, they are still a person worthy of dignity and respect. They're still here, they're still in there. And our response is to share aloha and to support them in this journey. There's a mana'o behind the ohia lehua design from community to really hold people who are living with dementia with high esteem and high regard, and it's really beautiful. So I encourage you to check out the website with more info, hawaiidementia.org. And if you're interested in being a dementia champion or in requesting these items, we'd love to talk story with you. And these are some images of people who are wearing the dementia champion pins. And, after we're doing different education, some of our community members will joining the movement to create dementia-friendly communities. Now I wanted to kind of transition our time to talk about some opportunities for caregivers to learn more about dementia, to learn more about caregiving strategies and things that can empower you on this journey. So I'll talk a little bit about SHARE, the REACH program offered by different organizations here in Hawaii, the Empowered Caregiver program, Savvy Caregiver, as well as Alzheimer's caregiving and the caregivers kit, and a few other educational opportunities or places for you to go for more information. So we wanted to highlight Catholic Charities Hawaii and their Circle of Care for Dementia. They've got wonderful evidence-based programs that are available to you. For example, the SHARE program here that you see on screen is the acronym is Support, Health, Activities, Resources, and Education. So it's a unique evidence-based program that brings a coach to support someone in the early stage with dementia and their care partner. So if you or anyone you know who's in the early stages, that might be a great option. But feel free to call Catholic Charities senior helpline there. They also have the REACH program, which stands for Resources for Enhancing Alzheimer's Caregiver Health. And they also provides personalized sessions with you and a trained coach to walk you through this evidence-based program to support you in your caregiving. Catholic Charities also has the Memory Mentor program, which is a free in-home service for seniors with memories, especially those who are living alone, without caregiver support. And they have volunteers who are helping people with that Memory Mentor program. So if you know anybody, feel free to share that information with them. They've got wonderful programs. We also wanted to highlight Project Dana, another great organization here on Oahu. They have the Caring for the Caregiver program and their phone numbers on there. They have various caregiver training workshops. I saw some recent ones, so they'll teach the hands-on care tasks. They brought like a nurse trainer in to talk about those caregiving strategies for personal care. They provide one-on-one counseling, and they also have that same REACH program that Catholic Charities have. That coaches are trained to provide that as well. So another option to support you in your caregiving and learning journey. And of course, Alzheimer's Association Hawaii chapter has lots of wonderful resources. I encourage you to check out their website, their local educational programs. The one I wanted to highlight is their Empowered Caregiver program. This is another in-person multi-week educational series for caregivers. And they have this in, I think, every county in Hawaii. And it's usually a 3-week series. So I think they have a new one starting every month, but they'll for understanding Alzheimer's and dementia, foundations of caregiving, communicating effectively, dementia-related behaviors, supporting independence, and exploring different care and support services. So for Oahu, Gina's the contact, and her phone number is on screen, but also anyone can call their 24/7 helpline to speak to a live counselor, to ask questions and to help them out. We also wanted to take a moment to share about the Savvy Caregiver program. And I think a couple of people in the room have participated in that. So feel free to share about your experience. So the Savvy Caregiver program is an evidence-based, multi-week caregiver training program that empowers caregivers with knowledge, skills, and the goal is to grow confidence and competence in our caregiving journey. And it focuses on guiding the person living with dementia through days that are as safe, calm, and as pleasant as possible. Really focusing on that consented involvement and engaging in activities. So caregivers would learn the strategies and then try those things out at home. But I think the best learning is when we get to share and talk in spaces like this and learn from each other. Because everyone's experience is different, And a few organizations that you can reach out to for this, you can call my office, the Executive Office on Aging. Kulanona Po'e Hawaii has created the Native Hawaiian adaptation of Savvy Caregiver. And then soon we'll be training the Maui County Office on Aging. Some of their staff are going to be trained to provide Savvy Caregiver soon. That's the goal. This is a new project that we're excited to share on behalf of Alzheimer's Caregiving and the Caregivers with Tony Vericella. He's created a caregiver kit and, created by caregivers for caregivers. And in this kit, he's really gathered a lot of really valuable tools and information that they'll send to you for free. And on screen has a list of some of the things that are included in the kit. If you're interested, you can scan that QR code, and I can also put the link in the chat later. But information to inform the caregiver, to help them engage their person, to provide updates, the stages or medical and legal documents, as well as some encouragement, hope, and comfort for the caregiver. And in the kits that are sent to people in Hawaii, we'll also receive the Dementia Champion pin and the I'm Here stickers we talked about before. Also wanted to highlight the new Dementia Education Hub created by Hale Kuike. With Dorothy Colby and the wonderful leadership at Hale Kuike, they've brought together some videos and articles that are grounded in positive approach to care, which is that dementia training curriculum that really focuses on the person's strengths and having a positive approach so that the care recipient and the care partner are working together on this journey. So one of the resources there at the Dementia Education Hub. I can put the link in the chat later as well. This is an upcoming workshop in November, Dementia by Day, led by Rachel Wonderland, who's an internationally recognized, dementia expert and consultant. She's going to be speaking at One Kalakaua on Wednesday, November 12th at 10:30 a.m. This is an in-person workshop sponsored by Kupuna Care Pair and Care Manoa with Todd Pang, and he's bringing her in to consult with their care homes here, but also making her opportunities available for our family caregivers in the community to learn from her as well. She'll be talking about best practices, creative and engaging activities, as well as dealing with difficult behaviors. Great learning opportunity if you're interested. This is a new program available in Hawaii for people who have original Medicare as their insurance. This is the model, or guiding an improved dementia experience. And it's an innovative model from the Centers for Medicare and Medicaid Services. And Straub Medical Center, their geriatrics clinic, applied and is an active participant in this model. And they started enrolling patients this past July, actually, to patients who are with the Hawaii Pacific Health System. And it's a comprehensive ordinary dementia care program, aimed at quality of life, reducing the strain on our caregivers and enabling people living with dementia to remain in their homes in the community as long as possible. And it's one of the first, I think, programs with Medicare funding for specifically dementia care services. And for people who are in mid to later stages of dementia, they have funds to support respite care, some limited respite care funds. That might be a helpful option if you're interested, and if your person has original Medicare. people who have Medicare Advantage plans, which are commonly provided by other private health insurances, wouldn't be eligible for this yet, since it's an innovative model right now. But if you do have original Medicare, this could be a helpful option to sign up for. They have an awesome team at Straub who's happy to help and walk you through that journey. And to close, I wanted to share a little bit about the State Kupuna Care Program, which our office, the Executive Office on Aging, as well as the offices on Aging partner to provide. And these are some of the services that they offer. So things like transportation, attendant care, case management, home delivered meals, homemaker services, chore services, adult daycare services, personal care services, as well as participant-directed care. And that's the one I wanted to highlight because it's a relatively new option for those in Honolulu County. Participant-directed care is similar to veterans-directed care in that the funding would go to the care recipient in order to pay a friend or a family member or someone of their choosing to provide care for them in their home. And they do have to meet a certain level of care, of course, to qualify for this. But it's another option, you can hire someone to come in to provide home care in the home. And this participant-directed option allows the person to select who provides that care, whether it's a friend, a family, or neighbor. One stipulation is that the caregiver can't be the same person as like the authorized person or their authorized representative, the person who's kind of signing off on these plans, just to avoid conflict of interest. So for example, if I was the caregiver who's providing that direct support, I could also be like in the forms if my person living with dementia, didn't have the capacity to do that or to make those decisions on their own at this time. It would need to be like another family member who's also involved in the process to help them be enrolled in this participant-directed care program. And I'm new to this, but just wanted to share it as an option, but encourage you to call the office to learn more about the details. These are some of the eligibility for the overall State Kupuna Care Program, which again is funded by state and federal funds for older adults, need to be living in the community and not in a long-term care facility. And they look at the person's ability to do activities of daily living, as well as instrumental activities of daily living. So these are some of the things that they'd be looking at when they call. To do that initial intake. When you call one of the offices, they'll schedule an interview and an assessment to get to know you more in your story, to see if you're eligible for those services, and to determine and to provide a referral to a service provider. And if there's a wait list, they can also provide options to other resources in the community that might be able to support you as well. And this is the phone number. This is the overall state number. That's 808-643-2372, or ADRC again, 808-643-2372 for the Aging and Disability Resource Center. And that phone number will lead to the county office on aging of the area that you're in. So if you're in Maui County, it'll help you get you there. If you're in Honolulu County, it'll help you get you to that office. Again, that's for the State Kupuna Care Program. I've been talking a lot, so I want to take a moment to pause and just thank you for your attention and for listening. And a few key takeaways, if anything, from this call is to remember that you're not alone. We can go through this together, that there's support and resources. And I think just being here in a group like this and being able to learn from each other is so valuable. So huge kudos to all of you for making time to join this call, to learn Caregiver Foundation and the wonderful programs and resources that Gary and Leanne and the team have for all of you. And I want to mahalo you for this opportunity to share. And my email is on screen. So mahalo nui loa.